Okay, so the sliders do not work on this floor because it's too textured. A towel's gonna work a lot better. If a person's doing it at home, they would have a sock on, and then on their other foot, they would not have a sock on, and that works pretty well for home exercise. But for here, you're just gonna use a towel, and everything that we used to use a slider for, we're gonna use a towel. Okay, so no more sliders. We're using towels. One other thing I noticed in the gym today, just want to make sure we're using the correct language on the patient control switch. This is not a kill switch, that's a negative connotation. It's not an emergency switch, it's a patient control switch. And patients need to be instructed properly when they're going to enter traction, especially for the first time. You want to let them know that this certainly should not provoke any of the symptoms that they came in with. If so, let us know, and we either will not do it or maybe we don't turn the intensity up as much. But let them know that this is a stretch. They will feel a gentle stretch, but if that turns into pain in any way, we want to know about it, and quite frankly, we want to discontinue the treatment a little early. So we're going to have this running for approximately 20 minutes, but 10 minutes into it, you start having discomfort, just press this button and a little bell will go off to allow us to come and take you off of the machine. But we don't have to last the full 20 minutes. It's like any other stretch. If you don't last a full 15 or 20 minutes the first time, in the next couple weeks you will. But this is your control switch. This is what you have to turn the machine off, because I don't want to come up 15 or 20 minutes from now to let you off and ask how you did, and you tell me, oh, this thing's been killing me for 10 minutes, right? So we need to understand the purpose of this. It's not for an emergency. It is to give patients the control of this machine, and if they feel like it starts to cross that line between being therapeutic and being something that's causing pain, they press this button, the machine stops, a little buzzer goes off, we come and help them off of it a little bit early. It's not a failure, it's just simply that they can't tolerate quite that much stretch today, but they may be able to in a week or two. Just like resistance training, you might not be able to tolerate 3 sets of 10 today, but in a couple weeks you probably will. So we need to package this information correctly to the patient so that they have a better experience, and call this the right thing. This is a patient control switch from now on. Thanks.